So what researchers looked at here in regard to folate and peripheral neuropathy is they looked specifically at 12 separate studies covering 3,015 people to be exact. 3 of those studies being randomized controlled trials, the rest being observational. Yet the results were consistent and I should say, well, repeatable. So what we're looking at right here is folate in reference to peripheral neuropathy. Average dose was about 1 to 6 milligrams per day, and the results usually tend to basically be best at around 4 to 6 months, at least in regard to the length of these particular studies themselves. So let's get right into number 2. Now check this out, see the results. Folate to the rescue. Look at the drop in pain scores. That is quite remarkable. Also, too, look at this, check the symptom resolution. Now, one of the studies, for example, an 87.5% outcome in regard to resolution of symptoms in relationship to peripheral neuropathy. So without further ado, let's get into the study itself. Folate supplementation for peripheral neuropathy, a systematic review. Background. Peripheral neuropathy represents a considerable and rapidly growing global health burden, with diabetic peripheral neuropathy alone impacting nearly half of diabetic patients. Evidence from experimental studies highlighted that folate supplementation may protect nerve health by supporting myelin maintenance, minimizing oxidative stress, and enhancing neurotrophic factors. Nevertheless, its clinical efficacy and safety in managing peripheral neuropathy have not yet been established. This study seeks to evaluate the role of folate in managing peripheral neuropathy regarding the efficacy and safety endpoints. This is quite astounding, especially with myelin regeneration, or I should say repair. So let's look at the next 2 charts in here. The amazing comeback. Check this out. Look at the nerve fibers as far as increase after the folate observational or randomized controlled trial studies themselves. That is quite amazing, as well as the reduction in neuropathy over the placebo was quite significant as well. To further delve into it, looking at basically the homocysteine level reduction, quite amazing. And also, too, the reduction in CRP, C-reactive protein itself, was quite astounding over the placebo group. Quite significant results overall. Again, 12 studies being reviewed, 3,015 people overall. That is quite amazing. Further going into the study, as far as the background, here we go. Folate deficiency has been identified as a potential risk factor for peripheral neuropathy, with emerging evidence suggesting that even a moderately low serum folate level may increase the risk of peripheral neuropathy among adults. Without interjecting publisher bias, that may even be more profound among those individuals having the challenge of diabetes. Moreover, experimental studies have demonstrated a protective effect of folic acid against peripheral neuropathy in diabetic rats, mice, by attenuating axonal degeneration and promoting remyelination. That is an understatement, again, when you looked at the human studies overall. Now, to proceed further into the conclusion, let's see 1 second real fast. Let's get past this one. And we already looked at this one, Dave. Good. All right. The present systematic review comprehensively synthesizes the available evidence on the clinical efficacy and safety of folate for managing peripheral neuropathy. Collecting the evidence from 12 studies comprising 3,015 patients, the narrative synthesis demonstrated symptomatic benefits with pain reductions up to 3 points on standardized scales and substantial declines in burning pain, deep aching pain, and electric shock pain. Notably, this is again quite amazing, symptom resolution rates reached 87.5% in some studies, with 66.7% improvement in neurological symptoms in another study. Again, repeating the outcome over and over again in regard to folate consumption. The neuropathy total symptom scores reduction ranged from 0.9 to 1.5 points, representing clinically meaningful symptomatic changes. In contrast, objective structural improvements were observed in the epidermal nerve fiber density, with increases up to 97%. I like to see that repeated over again. But that is quite, for those familiar, is quite an amazing outcome. Furthermore, biomarkers synthesized indicated rise in folate levels and reduction in homocysteine and methylmalonic acid. Generally, folate showed an excellent safety profile with only one adverse event reported among 1,367 participants, at least in those studies where they're looking for that. Now, further into for the healthcare professional, break this down. Those with meaningful thresholds, as opposed to two as well, meaningful endpoints. Again, this is for healthcare professionals that understand this, and general population as well. Please forgive me. And also two, now for the researchers. Here we're looking at the changes in the CRP, the homocysteine, where we want to go with future directions in regards to the information that we have here, and to further elucidate and of course, confirm these outcomes in larger general populations. There we have it there. Now, to takeaways, or I should say the how, I don't want to use the word how-to guide, but that's the way it was titled. The science behind the curtain, that's the dosages that were used. 1 to 6 milligrams per day was the most common dose, as high as 15 milligrams a day. Common length of time, 4 to 6 months. Differences in the folic acid, folinic acid, and methylfolate also elucidated here in this particular column. Each one works a little differently, even though folinic acid and methylfolate probably going to be most preferred form without interjecting publisher bias. And then the takeaways. There we have it. As far as also too the definitions in regard to, I should say, some of the abbreviations there. And it's quite amazing. This is just simply a very promising beginning step in this journey in regard to folate overall with consumption. This really has a kind of rumblings of potential as we did with vitamin D a few years ago. Folate, as far as basically the biological active forms, it appears, including the folic acid itself, not to add publisher bias, looks to have an incredibly promising future, especially in helping individuals with neuropathy, whereas something they may not have to suffer from this particular challenge as deeply as they have to, because there may be a solution right around the corner. Gratitude to the researchers. This is incredible information. I am humbled you watch and look forward to seeing what you and I both share next week. Incredibly outcome. This can help an untold number of individuals now and in the future as well. Gratitude. Thank you. And I'll see you all next time. Bye.